If you want to add any users, remember that all of your facilities are have a trusted agent. So you'll want to, if you know individual users have left your facility, you want to make sure that you let us know so we can deactivate them. If you have new users at your facility, we want to make sure that we give them access. So go through your trusted agent. If you don't know who that is, you can always contact us, and then we'll be able to get you into the right direction. So you want to make sure if anybody is that needs access,
or can I just go in?
We can give them access here through our user creation form. If you need this form sent to you, just shoot me an email or Adrian or Tequila, and we will be able to get that for you. And since nobody had any questions, I wanted to bring up one more where the patient attribution. I know this is a great tool that a lot of facilities are using. This is the patient attribution file. So essentially, we get this file from you, from your clinic, and then of all your patients, and whether they're self-pay, we have, a specific ID character. That's usually the character that's in your EMR system, because we get an updated list every month or every quarter from your facility. And this is how we notify if you're a pediatric practice and your kiddos, you want to know outside of Medicaid when they're going to the ED for your Blue Cross, your United, your Aetna, your managed care members, etc. If you have any past members that are attributed to your practice and you want to know that, you can be able to do that we require. So if you want that to notify you on all patients, please. This has been very successful for
Main Street Medical Clinic.
Sorry, I want to make sure you mute yourself whenever you're on the phone. But good to hear that Main Street's on. But essentially, this is one actual daily report that a facility uses, and I took out the PHI, but you can see, look at all the hospitals that patients are going to. And you as care coordinators, as nurses, as doctors out there, you don't necessarily know that this is happening, that they're going to the ED to 6 or 7 days. So interventions probably need to occur. So this is a great way for us to be able to notify you in this 24-hour daily report, regardless of payer. So essentially, if you want this, I know that Medical Associates of Northwest Arkansas, we are going to be assisting them with all of their primary care clinics just recently with Angie Holloway's team and John Jordan up there. So this is going to be a great tool for us to be able to notify you and be able to use the HIE so that you can not only meet your metrics, but then find out why your patients are going to the ER while your clinics are open through open access. Find out why your patients are continuously having an inpatient stay. And so that you at a primary care level or behavioral health or specialty, if you're maybe an OBGYN clinic that you see your patients quite often, of those higher risk patients, we can be able to notify you in one daily report from all of our connected hospitals. So great tool there. We're really excited. If you want that, you can let us know. Any final questions? And Amy, I will get your email to you so I get that. I can answer all your questions on the CCD. Any questions on integration, 24-hour daily reports, the immunization registry, how we can assist with MIPS, MACRA, CPC Plus, ACO, or CIN? Yeah, and Wendy, if you can send me an email, I will write your name down, just your doctors that you're associated with at your facility, and I'll make sure. And that's a great thing. I'm glad you brought that up. If you have care coordinators that are left, or you want to add to receive the 24-hour daily reports, you have to let us know so that we can run that through our system and attribute all of your Medicaid patients for PCMH with Medicaid so that it's going to the right care coordinators. So if you have people that have left, we first off need to deactivate them and then add the new users to receive that 24-hour daily report for all your Medicaid beneficiaries. And then if you're using this for all payers and a care coordinator changes, whether it's Medicare, Blue Cross Blue Shield, Medicaid, private pay, another private pay insurance, or even the PASS members. If they're attributed to you or you're their PCP on file now with the PASS, we can actually notify you on the PASS members. So we just need that list. So just let us know and we can update our records and get that through our system and attribute all those patients. Yeah. And then the updates to a CCD, it happens automatically when your patients maybe have seen patients, if they've left your clinic and then go to UMS, it automatically will then query and then bring that information back forward. So it's a constant process. So you may have multiple CCDs on that particular patient if they've been in and out or multiple facilities outside of your clinic. One thing too, more and more hospitals and clinics are sending continuity of care documents or CCDs. If you are accessing our virtual health record, you're going to find those under documents, and it's going to be one consolidated document. So as you're going through, I'm going to bring up actually a test patient really quick because we get this asked a lot. Where in the virtual health record is the information from Children's Hospital? Because they're sending CCDs, continuity of care documents, or our patient goes to Autumn Road and they're sending CCDs. Where does this information go? So I'm going to pull up my test patient and then be able to show you in the virtual health record where the continuity of care documents are populated and go. So I'm going to go into, you know, our tech team always, if this is an alcohol test, they live at 123 Happy Place in Sherwood. But essentially, this is where we bring all the information on this particular patient with the community ID. You're going to document, and it's continuity of care document, and it tells you the source. This is Autumn Road Family Practice. Now, this is test information, but you can click on there and get the one consolidated continuity of care document. It's pulling up. View as an HTML, and then you'll be able to see what's going on. So this is one encounter that the facility saw this patient. This is the table of contents. So let's say that I want to go down to vital signs. These are all the vital signs from that particular facility. This is the plan of care, the instructions, the goal set, the plan procedures, the instructions, all the encounters, if they have had a care management visit, historical summary, etc., office visit, and what occurred. So this is a continuity of care document, family history, social history, immunization, procedures, allergies, medications. So one consolidated document. So whenever I talked about integrating, you know, there's multiple facilities. On average, a healthier patient sees around 18 different providers. And that's the literature states that. And maybe a patient with comorbidities, multiple comorbidities, sees more than 18. So we're trying to make all those connections so that all that information goes into one consolidated way. So if your facility, your EMR system is integrated and we're doing that query and response, it's going to bring all that information in one consolidated document such as this so that it brings into your system. So it's very easy for you as the care team and the providers to be able to see what's actually going on with a particular patient. So if you haven't integrated with Share, I encourage you to and get in our queue because it is filling up. One that I didn't mention that we are working with and it's supposed to go live this next week is all of the CHI clinics here in the Little Rock region and out and all the way to Morrilton and Conway, specialty, including their new neuro Science and Surgery Institute over in Sherwood will be integrated with Share. They're on eClinicalWorks. And so we will be getting all of their primary care and specialty care clinics. That data is going to be made available to you if you refer to anyone within the CHI network through Share. So we have an ECW eClinicalWorks hub and an Athena hub. So essentially that's how we are being able to bring those through the hub that we've created for Arkansas. Any final questions before we are at 1:15? I did good on time. You can type it in or you can shoot me an email. All right. Well, I appreciate everyone being on the call today. Hopefully you've learned a little something. And if you have any additional questions and maybe I didn't go into great detail on something or that you wanted a little more clarification, please shoot me an email. My email is justin.bolines@arkansas.gov. Or you can shoot Adrian an email, adrian.jones@arkansas.gov. And then we're on those emails. And then tequila, it's tequila.smith@arkansas.gov as well. T as in Tom, I-Q as in Quebec, UILA.smith@arkansas.gov. So we're the team here to help you out and triage wherever you need to go. So appreciate you all, and I hope you have a great rest of the week. Have a good day.